Hello, everyone, and welcome to today's podcast on the prevalence of GI disorders among veterans. And today we're speaking with Dr. Mark Riddle. This program is sponsored by the International Foundation for Gastrointestinal Disorders, also known as IFFGD. Dr. Riddle serves as the professional of internal medicine and associate dean for clinical research at the University of Nevada, Reno School of Medicine, and is also the associate chief of staff for research with the VA, Sierra Nevada Healthcare System. And he was named the associate chief of staff actually, like a year ago now?
A year ago, yeah.
Yeah. So thank you so much for joining us today, Dr. Riddle. And if any of our listeners today would like to learn a little bit more about Dr. Riddle and what he does, please click the description below. So thank you again for joining us.
I'm glad to be here. Thank you for the opportunity.
Dr. Riddle has more than 2 decades of combined research and the development of public health, academia, and clinical medicine expertise. But today, he will be sharing with us all we need to know about the prevalence of GI diseases among veterans and what those conditions are, as well as what veterans can do when they're seeking support. So, Dr. Riddle, at what rate are military personnel affected by gastrointestinal disorders, and what is the presumptive service connection?
Great. Again, thanks for the opportunity to share what I know and what people can know. But I'll first preface in that we need to know a lot more. So I hope to give some information, but also say where we need more information. So regarding your question though about the rate and then the presumptive service connection, so that's a two-part question. So let me first answer the part about the rate of gastrointestinal disorders in the military. Gastrointestinal disorders are a very broad area and can include colon cancer, upper GI disorders, pancreatic disorders, functional bowel disorders, and things of that nature. So it's very broad. But as far as I know, there's been no comprehensive clinical burden of disease study done in the military to precisely answer this question. But what I do know, there was a 2018 report put out by the Department of Defense where they looked at the primary causes of medical encounters among military while they're in garrison or not deployed, and then while they're deployed. And GI disorders as a broad class of things, again, these many different things, was in the top 10 of disorders for reason that military people are seeking encounters. But I want to drill down a little bit more because, and again, the functional bowel disorders and really the kind of the scope of this topic of today. I think there's two things that we don't really know and that are underrepresented. So one thing is acute gastrointestinal infections. That's a GI disorder. It's also a GI disorder that has been known to trigger functional gastrointestinal disorders. And we know that acute enteric infections or acute GI infections are wildly underreported. In deployment, our studies have shown that basically only 1 out of 5 people who have an acute gastroenteritis or a bacterial gastrointestinal infection actually get reported. And so it's the data are underreported. Similarly, we know not so much in the military, but just nationwide that functional bowel disorders are underreported as well. They just go misdiagnosed, and so that being said, as I started, we don't have a good sense of the full burden of disease, but it's significant in what we do know. There's less even known about the veteran population with these things, and so I think one of the take homes is that it's very important. We know it's important because it's important for the rest of the country. We know it's important from the studies that have been done, but more is needed to study. Part 2 of your question is about presumptive service connection. There's probably better experts on this, but I'll try to explain as best as I understand. So the VA presumes that certain disabilities were caused by military service, and this is because of the unique circumstances of a veteran's military service. A lot of variety of exposures and occupations and things that we just don't know, but are risky, right? So if a presumed condition is diagnosed in a veteran in a certain group, they can be awarded disability compensation. And so that's important that our country and the VA recognize that there are these presumed conditions and that we want to make sure that we take care of you if you get sick from them. So with respect specifically to gastrointestinal disorders, there was a 2011 rule that decided that there is a positive association between service in Southwest Asia during certain periods and the subsequent development of functional gastrointestinal disorders. And it clarifies that functional gastrointestinal disorders fall within the scope of the existing presumptions of service connection for medically unexplained chronic multi-symptom illnesses. Now that's a big mouthful, but basically what that's saying is that the VA recognizes that these disorders can be related to military service, specifically related to Gulf War, as well as the operations in Southwest Asia. And I would just add that, again, I'm not the expert, but if you have any questions, you should definitely reach out to your VA benefits office, and they can help you kind of navigate all of that. Yeah.
Yeah, and I think kind of what you touched on as far as like of the rate, like it being underreported, especially of those in the military, and then but also you mentioning that our country and the VA they recognize that this is something that is continuously and it's happening, and that they want to be able to support veterans. And you mentioning like just to seek help from your VA staff, I think is a great point. And then also you mentioned about acute gastrointestinal infections. So in part of that, what are some of the most common functional GI disorders that researchers have found to be associated with those who have served in the military?
Yeah, and that's a great question. So in our research that we did, so before I came to the VA and the School of Medicine, I spent I was a Navy physician and a researcher, and studied this area and with teams of researchers. And we looked at a lot of different databases and other population studies in the active duty military population. And what we found is that they're quite common, but that functional constipation followed by IBS and dyspepsia are the most common functional disorders. But again, I would say that this has been done based on analysis of medical encounter database, and not the most rigorous study, which would be to ask veterans about their symptoms that they're having. Again, because of the underdiagnosis, we don't fully know. It may be that people with constipation are just more likely to go to the doctor because they think that can be treated better. And so it may not be that constipation is more than IBS, but it is because that's how we're measuring it based on medical encounters. And I will also say that, again, here there's a gap in our knowledge about these disorders in veterans, and this is an area that needs more study. But because they're common in the active duty population, we know that they would be likely common in veteran populations. I think the one study that gets at what's going on in veteran populations was a study that was done nearly 2 decades ago. It was right after the Gulf War. And they looked at veteran CVs, which are the Navy construction battalion type people who go in and build airports and buildings and and they're usually first in and doing a lot of kind of construction to get ready for sites and building sites up. And they looked at a population of CVs that deployed to the Gulf War, and then compared it to populations that deployed elsewhere in the world, like Europe or other places, and then those that didn't deploy at all. And they found that among those that deployed, there was a 3 to 4 times higher risk of developing irritable bowel syndrome specifically. They didn't look at all the functional bowel disorders, but irritable bowel syndrome specifically. So again, I don't know what the data is, and I don't have the answer to that quite good question. But irritable bowel syndrome is very common, and as is constipation and functional dyspepsia.
Yeah, and I think also kind of what you mentioned about most of these are reported because it's what people have reported at their office whenever they've seen their doctor, and that it is underreported, and that it's so important. And thank you again for doing the podcast because it is important to raise awareness about some of these things. So now that we kind of know some of the disorders, can you briefly share with us some of the symptoms that are commonly reported by military personnel?
Yeah, and so symptoms, I think, specific to these gastrointestinal disorders, they're common to what I think you would find in the general population. They are diarrhea, abdominal pain, constipation, bloating, urgency, those types of symptoms, and these are the symptoms that don't go away after they either get an enteric infection or they develop these disorders after deployment. So I would say that they're not really different than the symptoms that non-veterans get, with the exception that in my practice, I'm seeing a lot of veterans with PTSD and anxiety and some depression. And so those are maybe mixed in similarly, but those often are accompanying symptoms and important and part of the whole kind of the holistic picture of what's happening to that veteran. Not only includes stuff that's going on in the GI, but some of it's these other feelings and emotions as well, and they're related, they're connected. These are disorders of the brain gut, so it's really connected, and it's one thing. We just don't quite know how to figure it out quite yet.
Yeah, and something that you guys are doing research on
Right.
to figure that part out. And I think like what you mentioned as well about the patient or the veteran as a whole and understanding what's the bottom line between these connections will definitely help in the research and gain a better understanding of why are the veterans, why are GI disorders occurring more within veteran population.
Mhm.
So you mentioned a little bit about the symptoms and the disorders that are associated with veterans who have served in the military, being like IBS or functional dyspepsia, constipation, and even along the symptoms with diarrhea, bloating, and things like that. What can veterans do who are actively serving or someone who is a veteran? What can they do if they're experiencing persistent GI symptoms?
Yeah, and this is such a great question, and I thank you for asking and the opportunity to share what we should be doing and what we are doing. But if you, as a veteran or an active duty person, have these kind of persistent, just GI complaints and problems and pain and changes in bowel movements and anything persistent, you need to go see a provider. You need to go get it checked out. There could be some things like, you could have deployed and got a parasite, and so that could be detected and treated really easy. Or you could have, something like celiac disease, which is not, it's rare, but it's not that rare. And so going in and for persistent abdominal, there are good diagnostics to kind of get at a lot of stuff. But in the end, it may be likely that you have one of these functional gastrointestinal disorders that we don't have the right test for. We don't know exactly what it is. So go see a provider. And if possible, find a gastroenterologist, so a specialist that works in GI that knows functional bowel disorders and specializes in it and understands it and treats patients, because it does take it takes a good, strong patient-provider relationship to really tackle this together. But I also want to give some key points as you start beginning your journey to treatment. And that is that what you're feeling, it's not in your head. We just don't have the right lab test right now, or the right x-ray, or whatever right test. We just don't have the right test right now to say, this is what's going on with you. So, but know that it's not in your head. At the same time, know that anxiety and depression and thoughts your gut is connected to your brain. Know that those are connected. So when you seek treatment and you start getting into treatment, there may be things like reducing your anxiety or taking care of depression or other symptoms that are going to be important for your GI symptoms to get better. Also know that diet and exercise are key components to managing disorders. We have a pretty good understanding, why diet is important, and good care would likely involve a nutritionist that can help you to make sure you understand how diet. But it's not the same diet for everybody. It can vary from person to person. So diet's important, but you got to do some detective work to figure out what about the diet it is, and that's where having a good nutritionist to really help you work through that, and understanding food and how food affects your symptoms is important. And then exercise has just so many benefits. We don't fully understand why exercise works for functional bowel disorders, but we know it works in the studies that have been done. And so exercise is important as well. I also want to say that there's got to go in knowing that right now there's no cure for these disorders. These are usually lifelong disorders. They often go away on their own, and they don't persist forever. Sometimes they go away and they come back, but they can be chronic lifelong disorders, not always, but understand that you're not going to be getting a cure for this. But at the same time, there are a lot of good treatments to try. And you'll find that as you get on your journey for treatment of your disorder, you're going to try a lot of things. Some of it will be targeted, like you and the provider will figure something out and say, okay, we think it's this. Let's try treating it with this and see if it works. But there's no guarantee. And so, but there are a number of things that you can try. And sometimes it's the process of elimination. Okay, let's try this. Okay, let's try this. Maybe you have to add things together. So just be ready that it's a journey. You're not going to get a single thing. It's going to be a little bit of trial and error. Also know that having this disorder doesn't increase your risk for cancer. It doesn't increase your risk for early death or anything like that. So it's very burdensome. I understand how burdensome it is, but it's not going to cause you to die early or get cancer. And so just be comforted by that. And yeah, I think it will get better over time. It does. And working with your provider and getting to know yourself and getting to know your diet and all of this together, there's hope to get better. And there's a lot of research going on right now to try to understand, so that we have that test and we can say, okay, you took this test, now we know what to treat you with. That's where the field is moving, and hopefully in the next 5 to 10 years, we'll be treating more targeted and better. Yeah.
Yeah, and I really like how you mentioned that when these veterans, or even someone that's actively serving, are experiencing some of these GI symptoms, to seek help from a professional who is knowledgeable in the area. But also you mentioned that bringing in a nutritionist or someone else, and that basically speaks to that this is a journey, but you have a team of support.
Yeah.
People who want to help you create a treatment plan that's best suited for that patient. I really like that you touched on that. And you mentioned earlier in our conversation about Gulf War syndrome. And basically, could you explain a little bit about the GI disorders that might be associated with Gulf War illnesses, and also what type of plan has the VA developed in hopes to support those Gulf War veterans?
Yeah, so there's a real recognition of the health effects that we don't fully understand that are associated with veterans of the Gulf War, as well as from more recent Southwest Asia deployments as well. Again, I'll go back to that CV study where I think there's few studies that have really looked at this, and that was one that was really well done. It was done right after the Gulf War, and so that's why I go back to that, even though it's a really old study. And they looked at these CVs that deployed or were in the Gulf War, and then those that didn't or deployed elsewhere. And of the symptoms that they experienced after deployment, diarrhea was 1 out of 4 people had diarrhea after coming back from deployment. That probably wasn't due to having an infection. It was probably a new onset IBS or a functional diarrhea disorder of some sort. Also higher than the control veteran populations were appetite loss, stomach pain, and constipation. So all of those symptoms were more common among CV veterans compared to CVs who didn't deploy to the Gulf or didn't deploy at all. So those are the symptoms, and sometimes all more than one occurred. So on the second part of your question, Gio, what the VA is doing. So the VA has recognized that there's this class of disorders that are called medically unexplained illnesses that are common among veterans, and functional GI disorders with all of these symptoms are one of four categories of medically unexplained illnesses that the VA has recognized. And what does that mean? Well, that means that we recognize that these disorders are occurring in higher frequency, and we don't really understand the basis of it. And nobody does, even in non-veterans, we don't fully understand it. And so what the VA is doing, I mean, I can't speak broadly to the VA plans, I mean, but from what I understand and know is that the VA is investing a lot of research as well as clinical education, and there's a podcast of war-related illnesses, injury, that's out of New Jersey, and it's trying to raise awareness of providers and veterans about these disorders so that they get in, they get care, and they get the best treatment possible. So that's one thing. The other thing that I started here locally in Reno is that I started an IBS clinic here at the VA, where all I see is IBS patients. And I'm using that as a way to improve the care of individuals, but also try to create better systems of care, as well as further research to understand what's going on in the veterans that I see that have these disorders.
Yeah, and it goes back to kind of what you mentioned earlier, that it kind of starts of patients reporting those symptoms and issues that they're having with their medical provider. And the fact that you are, in Reno, seeing IBS patients, trying to gain a better understanding, is just one step closer to what the VA is doing with the research, and just raising awareness is to gain a better understanding of why this is happening. So as we begin to kind of wrap things up, November 11th is actually Veterans Day. And that's the day that we all recognize those who have served in the military. So why is it important? I know you touched on it a little bit, but why is it important to raise awareness about gastrointestinal diseases among veterans? And what do you hope our listeners gain by listening to this podcast today?
Oh, great question. So functional GI disorders, as well as other GI disorders like colon cancer, fatty liver disease, cirrhosis, these are all significant problems in the veteran population, and uniquely in the veteran population. Yes, they occur in others, but they are particularly problems, and they really affect quality of life. And so it's important to recognize that this group of disorders and that this is important to the veterans and veteran health. I think specifically for functional GI disorders, if I could get one message across, I'd say, these are not in your head. These are real things going on, and we have better diagnostics, and we have better treatments, and get help, and find that clinician, that provider that can work with you. It's going to take a lot of self-work too. It's going to take a lot of understanding yourself and understanding how your diet, how your thoughts, how exercise, how all that fits into the disease. But know that it's not all in your head, and that there is a pathway forward to a better life with these disorders. So finding a knowledgeable provider, that may be a challenge. I would keep trying, and I don't know a solution to that, but keep trying. They're out there. There are a lot of good providers that understand this. But realize you're going to be working with a team. So you're going to be probably working with a psychologist, a nutritionist, somebody who's trying to get you to exercise, and then the clinical provider that's trying out different drugs, different fiber, different modalities of treatment to find that combination that best works for you. And then I guess what do I hope for listeners gain by listening is, well, they should know that they're not alone, and there's hope and getting better. And there's a substantial amount of research in the VA and nationally to develop, better diagnostics and treatments to improve these outcomes. And I'm hopeful for the future.
Yeah. Thank you so much for those comments, and thank you for joining us today and for sharing your insights on this topic. I think that it's so important for us to understand exactly why this is occurring at a higher rate among veterans, especially because they are, fighting for us to be able to, live freely in this country. So just the fact that we are researching and trying to gain a better understanding so that we can all support our veterans, it says a lot. And we can't thank you enough for sharing your insights on this topic. Thank you so much, Dr. Riddle.
Thank you.
Thank you to everyone who also listened. And again, if you would like to learn a little bit more about Dr. Riddle and what he does, please click the link that is in our description. Thank you again.